Hi friends, welcome back to my channel. I haven't done any videos for some time because I was quite busy. So here I am again with another case note explanation. I know many are struggling to crack their OET writing even though they are reducing the score. As per the NMC, they will consider C score for writing, but the final result is not yet available. Just wait for 2 weeks. So let's see another example. So as everyone knows, the allocated time is 40 minutes for writing and 5 minutes before we get for reading. So what we have to do? Read the case note thoroughly during that 5 minutes and select the relevant information according to the reader. We should include the information only what is essential for the reader. Today's date 10 June 2010. You are a registered nurse at the Queensland Eye Hospital and you are responsible for the care of Mr. James Hutton following the operation he had today. That is right corneal graft. That is the procedure name. Patient details: name James Hutton, address Lilyvale, Mugalia, Queensland. Date of birth is given, gender is given. Medical history: blind in left eye following corneal tear in 2001, corneal graft to right eye in 2000. And cornea in right eye is now distorted and needs replacement. Hypertension diagnosed in 2003. These are the medical history given. So let's move on to the social history. Social history: marital status widowed, next of kin William Hutton, that is son, employment retired grazier, religion Church of England, background information: lives in separate accommodation with his son and his family on the family farm, is generally independent despite limited navigational vision in his right eye and no sight in his left eye, able to walk without assistance and assist with light work on farm. World War II veteran and has a gold card, which means his expenses for all healthcare and related transport are paid by the Department of Veterans Affairs. Then current medications: Atacant 4 mg money, Lipex 10 mg nocte, chloromazepine eye drops 1 drop in the right eye QID, Prednisolone 4 eye drops 1 drop in right eye QID. Shake well before use and give 1 to 2 minutes after chloromazepine. Then Tinopt eye drops 1 drop to left eye only BD. Panadol 1 gram PRM maximum 4 grams per day. Then let's see the nursing care needs. Mr. Hutton was given sedation and a local anesthetic to his right eye. The local anesthetic was given and he will not be able to open the right eye for several hours. He will be totally without sight until this occurs and should then have restricted vision. A clear eye shield must remain on his right eye at night to protect from knocks while sleeping. He will need assistance with mobility, showering and dressing. Dark glasses have been provided by eye hospital to cut down glare when outdoors if not needed. Mr. Hutton has an appointment with his eye surgeon at 11 am tomorrow. He should be ready for discharge by 10 am when a carer will transport and assist him to the doctor's surgery. Then what is the writing task? The Queensland Eye Hospital provides day surgery only and does not provide overnight care. Patients who need nursing care overnight care sent to a post-operative care residence. Using the information in the case notes, write a letter to the registered nurse at the post-operative care residence explaining Mr. Hutton's condition and the care he will require. So now we understood this patient has undergone this surgery and they are not providing any observation in this hospital, so they are just transferring for the overnight care to the residence care. So according to that information, we should provide only the information what they need to provide the care for 24 hours like or overnight. After that, next day he will be discharged and he has appointment. So we should include only this information in this letter. So let's see how we can write it. So our reader is the registered nurse, post-operative care residence. Then the date was given 10th June 2010. Dear nurse, reference Mr. James Hutton, from a date of birth 25 March 1920. So how we can write the introduction? I am writing to refer Mr. James Hutton, who underwent the right corneal graft replacement. He requires overnight care at your facility. Then we can write the next paragraph. Mr. Hutton presented to hospital with a distorted cornea of his right eye, for which the surgery was performed successfully. Mr. Hutton was given sedation and a local anesthesia which blocked his right eye. Therefore, he will not be able to open the affected eye for several hours. So, as it is same in the case note, it's better to avoid. Then, in other way, we can write, prior to his operation, Mr. Hutton has received sedation and a local anesthesia which blocked his right eye. So, it prevents him from opening his affected eye for several hours. Otherwise, you can write it like that. Please note, he will not be able to open his affected eye for several hours, as he has received sedation and local anesthesia prior to his surgery. So we should change the word order, or we should use the synonyms. It will increase your score. Don't copy the same thing from the case note. Next we can write, Mr. Hutton's current medications are Lipex 10 mg 1 drop in each right eye 4 times daily, along with the 10 eye drops, 1 drop to left eye twice daily. Panadol 1 gram can be administered as needed with a maximum dose of 4 grams per day. Otherwise, you can mention, please ensure the maximum dose should reach only 4 grams per day. Then next we can write the social history. Mr. Hutton is a widower who lives with his son and his family. He is blind in the left eye following a corneal tear in 2001. He has had hypertension since 2003 and is on Atacant 4 mg at morning. And you can mention if he was independent in his activities, although he is blind, he is independent in his daily activities. The next is the recommendation. Considering the above information, it would be appreciated if you could provide necessary support for Mr. Hutton. It is important to keep a clear eye shield on his right eye in order to protect from its return. We can write in order to avoid any knocks or movement while sleeping. Then what else we can? He requires assistance for daily living activities. Kindly note that he can wear dark glasses to reduce glare when he goes out if needed. Like that we can write. Then what else here? Please note he has an appointment with his eye surgeon at 11 o'clock tomorrow, and ensure that he is ready by 10 o'clock. Then we can write the conclusion sentence. Please do not hesitate to contact me if you have any queries. Then, as there is no mismention, we can write yours faithfully, registered nurse. I think it's clear for you, and if you need further clarification, please comment below in the comment box. And if you're watching this channel first time, please subscribe it, like it, and share with your friends, so at least they can also benefit from this channel. Thank you for supporting and keep watching. Thank you. Bye.